platforms is up and going. Okay, YouTube is pretty okay. Today our topic is pregnancy and PCOS. Okay, all good. This is a live, so when we in live, when I see my friend up in here, will say hello and to everyone, and I want you to say hello to me as well. If you see this live video, even though you replay this, watch after the live, and please leave some comment down there and let me know what you think about this. Okay. So hi, hello, Chinese teacher medicine. I can only see you. I'm not quite sure your name, but on Instagram. Thank you for saying hello to me. Okay. Now our topic today is pregnancy and PCOS. So every day, every morning, and here I'm in New Zealand, and I'm gonna go live with you. Hi, Veronica. Thank you. I'm very good today. Thank you. So if you're on live, hi Eric, how are you? Please say hello to me and then give me a thumbs up and share this live video as well. If you're on Facebook and Instagram, thank you very much. If you're on YouTube, please take the link and share on your social media after this live video. Thank you very much. Okay, let's start. Now today our main topic is about pregnancy and PCOS. So I'm pretty sure that if you're a practitioner, when we see more, the chance that we get to contact and see a PCOS patient is more chance that when you see the fertility patient, because this is one of the main reasons that they come to you, because they felt it very difficult to get conceived, right? Then I don't know whether you know about it, is but 7 to 80% of women with PCOS have fertility problem. Yeah, that's pretty high though. That's pretty high. Which means that it's 20 to 30% of women with PCOS, they have no problem conceiving baby, right? So I do have this experience, right? And patients come to me and they say, put down a PCOS, and then what happened is you look at the patient, they overweight, they have extra go here go and here and the tummy, and they probably have acne as well, and but the period is pretty regular, or some of them may miss 1 or 2 months, but they never have problem with conceiving a baby. They do though. You do see in this patient in your clinic, if you see fertility patient, then I ask them, well, you've been diagnosed with PCOS, but do you have any kids? They say, yeah, 2 or 3 or 4, and have you ever have difficulty conceiving a baby? So, no, it does happen for them, you see. So they have no problem conceiving baby. Yeah, so yes, PCOS is one of the major reasons for infertility. it has about 7 to 80%. But if you just, because patients come to see you because they have infertility problem, but we didn't actually realize there are patients with PCOS. They have no problem conceiving, because we never see them. They are not coming in for PCOS just because I want to treat my. I'll tell you, for those 20 to 80% of patients, they're happily living in their life, and they never sick. They never look for treatment for PCOS. There are people like this. They never get treatment, and the time they come in for treatment is for other problems, for other back pain, neck pain, and they're not coming for because I have a irregular period, and I want to get my period regular. And it's so funny that if you're in pain, you want to get treatment. But if your period is irregular, you never thought about getting treatment for it. You only want to get treatment for your period when you want to get pregnant. Does it make sense? That's how I feel. It's how I feel in my clinic when I see patients. Not many people want to come in and just in my current practice, okay. But in China, when I was in China, and the mom would take the daughter, take it in and say, "Well, our period is not regular. I want my daughter to take some herbs," and that is quite a lot, but not in here. I rarely get patients to come in and say, "Well, my period is irregular and I want some treatment." But in China, that it's common that the mom take the daughter, come in and say, "My daughter's period is irregular," something like that. Yeah, it's a funny thing. Yeah, right. Now, PCOS, first, if you suffer from PCOS, it's difficult to get pregnant. That's the first one. That is because your period is irregular. You have high level of androgen, the male hormone. Then when you have high male hormone, your female hormone is less. Then you are not ovulation every month, or your ovulation in a different time. That is why it causes difficulty in fertility. The next thing is, if you have PCOS, the conditions, then it actually also increase the risk of pregnancy complication. So we talked about before, if you suffer from PCOS, you put on weight, and it's a high risk for what? It's very high risk for metabolic symptoms. So let me remind you again, what's metabolic symptoms? High blood pressure, high blood sugar, high cholesterol. Right. Now, if you suffer from PCOS, then you got pregnant. That is good, right? First step is good. But while you're pregnant, Yeah. And it may cause high blood pressure due to PCOS. It may cause high blood sugar. So it may lead to pregnancy high blood pressure or pregnancy high blood sugar. Okay, so the diabetes problem. So if you suffer from PCOS, you got pregnant, that's great. But watch what you eat is very, very important. Okay, you don't want to end up with um, blood pressure issue or blood sugar issues. Okay. And it also, think about if you have a blood um, sugar and blood high blood cholesterol, high cholesterol issues in your blood. That means your blood is thicker. So the blood flow is slower. When the blood flow is slower, the circulation is not as good. That would cause not enough blood flow into uterus to nourish the baby, to supply blood flow into uterus. Then that may cause miscarriage. Right. So does it make sense to you? Right. So PCOS is risk, very high risk for miscarriage, high blood pressure, and diabetes while you're pregnant. So when it comes to treatment, we're gonna talk about tomorrow what diet and lifestyle tips to treat PCOS. So you don't wait until you get you got pregnant and start watch your diet. You know? You start to watch your diet before pregnancy, while you're preparing for pregnant, because PCOS through a changing diet, it can help PCOS symptoms a lot. Okay, it's not easy, but it's very simple. Simple to follow diet, simple to do the extra thing rather than just relying on treatment. Because I've seen a lot that patients change the diet, they themselves, they ask Dr. Google, and a lot of real cases out online, and they follow the diet, and then before they come to me, they lost weight already, and the period become much normal, and they really get the benefit. And exercise, of course, it would help. And when this happens, they still come to us because they want to get pregnant. Yeah, they got better. They got a lot of benefit. They can tell the difference since they changed diet. Okay. So again, when it comes to PCOS, you're not relying on just acupuncture or Chinese herbs. You're not relying on hormone therapy. No. But unfortunately, things that I see in my clinic, patients that I see in my clinic when they've been to fertility expert. Hi Max, how are you? And they never mention about changing the lifestyle in diet. You see, this is something that I always feel, I always felt, why didn't they tell the patient? They just tell the patient to go for IVF. The thing that is not the job. Their job to tell the patient changing lifestyle or change the diet. They don't give these things. Of course, they may think that maybe a nutritionist expert, so they don't tell patient at all. At all. I asked my patient literally, asked them whether you have been to fertility associate, you've been to fertility specialist. Well, they offer you IVF, but do they tell you that something that you can do at home? I said no. It's just simple. Like they only want you to rely on the treatment, then you don't have to do anything. When you suffer from a disease, let's say PCOS, you can't be lazy. When I say you can't be lazy, is you can't just go some way to ask for treatment and then you do nothing at home. You see what I mean? You have to do your own work. You have to do whatever you could to speed up the treatment results and to maintain the result as well. Does it make sense? So if this is the case everywhere, easy way, yeah, it is, it is. Yeah, it is easy way, right? So what's different, you know, what is different between us and those practitioners? We are real different. We actually get our patient, we provide them a video and let them know how to change the diet, why that's so important. We provide them a free acupressure program that they can do at home, and we encourage them to exercise. We literally ask our patient how often you exercise. You know, we encourage them to do this, and this is very, very important. So when it comes to pregnant, so when patient conceive in through our help, through our support, then we ask the patient to keep going to get acupuncture treatment weekly up to week 12. And over week 12, then we ask the patient after 3 months, come and get treatment once monthly, every month, because they are high risk of pregnancy complication, right? So we want to prevent things happen. So we ask patient to come once monthly after 3 months of weekly treatment. Some of them you may want to see patient more, not because they have PCOS, it's because if they have pain or nausea or vomiting. We see patients that who vomit throughout the pregnancy, nausea, or they have a lot of pain in the body throughout the pregnancy. And therefore, you want to see the patient more regularly. Okay, we've seen this patient who have a lot of pain in body. Needle in, felt better. Needle out, few hours, the pain started again, build up, and the needle it gone down throughout the pregnancy. That's horrible, isn't it? And the vomit and nausea. So acupuncture can help. It's caused by the hormone, because the hormone change and they suffer from pain. But there's no drugs for them. There's none treatment for them. But acupuncture is a very good way for it. Okay. That's it for today. This is about pregnancy and PCOS. Okay, tomorrow we're gonna talk about diet and lifestyle tips. Thank you for joining us today, and thank you very much, and stay awesome, and I love you all. I'll see you tomorrow morning. See ya.